CD74, also known as the major histocompatibility complex, MHC, class II invariant chain, plays a significant role in the immune system and is implicated in various autoimmune and inflammatory diseases, including those seen in rheumatology. In this context, CD74 is of interest due to its involvement in 1. Antigen presentation. CD74 helps in the processing and transport of MHC class II molecules to the cell surface for antigen presentation. This is essential in activating the immune system's response, particularly in autoimmune diseases. 2. Association with spondyloarthropathies, SPA. CD74 has been studied in relation to spondyloarthritis, especially ankylosing spondylitis. Its role as a receptor for macrophage migration inhibitory factor, MIF, has drawn attention, as MIF-CD74 interactions can promote inflammation and may contribute to the pathogenesis of SPA. 3. Rheumatoid arthritis, RA. Research has shown that CD74 is highly expressed in synovial tissues of patients with RA. The interaction between MIF and CD74 in RA can promote synovial inflammation and joint destruction. 4. Therapeutic target. Given its role in inflammatory pathways, CD74 has been explored as a potential therapeutic target. Inhibiting the MIF-CD74 axis could offer new strategies for treating autoimmune diseases like RA and AS. The CD74 pathway's relevance in inflammation and immune response makes it an area of active research in rheumatology. CD74 plays a critical role in the pathogenesis of rheumatoid arthritis, ARA, due to its involvement in immune system regulation, particularly in the inflammatory cascade and the activation of antigen-presenting cells, APCs. Here's a detailed breakdown of its role in RA pathogenesis. 1. Antigen presentation and immune activation. CD74 is part of the MHC class II complex found on the surface of APCs, such as dendritic cells, macrophages, and B cells. In RA, these cells present autoantigens to T cells, initiating an autoimmune response. CD74 assists in the assembly and transport of MHC class II molecules from the endoplasmic reticulum to endosomes lysosomes, where peptides are loaded onto MHC class II molecules for presentation to CD4 plus T cells. This interaction leads to the activation of T cells and promotes the immune dysregulation that characterizes RA. CD74 and macrophage migration inhibitory factor F interaction. CD74 acts as a receptor for macrophage migration inhibitory factor, MIF, a cytokine involved in promoting inflammation. MF binds to CD74 on the surface of immune cells, initiating a signaling cascade that leads to the production of pro-inflammatory cytokines such as TNF-α, IL-6, and IL-1 bulpor. These cytokines are pivotal in sustaining the chronic inflammation seen in RA. MIF-CD74 signaling also enhances the recruitment of immune cells to inflamed joints, perpetuating synovitis and joint damage. 3. B-cell survival and proliferation. CD74 plays a key role in B-cell maturation and survival, which is critical in the autoantibody production seen in RA, particularly rheumatoid factor, RF, and anti-citrulline protein antibodies, ACPA. Its involvement in B-cell activation enhances the chronic autoimmune response, leading to the continuous production of antibodies that target joint tissues, contributing to joint destruction. 4. CD74-mediated inflammatory pathways. The interaction of CD74 with also activates other signaling pathways, including the NFB pathway, which regulates the transcription of genes involved in inflammation. CD74 signaling can promote the activation of ER and PI3K ACT pathways, leading to increased survival and activation of inflammatory cells in the synovium. This results in the proliferation of synovial fibroblasts and the production of matrix-degrading enzymes such as matrix metalloproteinases, MMPs, which contribute to cartilage and bone erosion. 5. Synovial inflammation and joint destruction. Through its interaction with MIF and activation of pro-inflammatory pathways, CD74 contributes directly to synovial inflammation. In RA, the synovium becomes hyperplastic, with increased infiltration of immune cells and the formation of pannus tissue, which invades and destroys cartilage and bone. CD74 expressing cells in the synovium perpetuate the inflammatory milieu by secreting cytokines and chemokines, maintaining the chronic state of joint inflammation. 6. Potential therapeutic target. Due to its role in RA pathogenesis, the MIF CD74 axis has been explored as a therapeutic target. Inhibiting CD74 or blocking the interaction between CD74 and MF could potentially reduce inflammation and joint destruction in RA. Some experimental therapies aim to interfere with this pathway, offering a potential novel treatment approach for patients with refractory RA. In summary, CD74 contributes to RA pathogenesis by promoting antigen presentation, triggering pro-inflammatory signaling via MF, supporting B-cell survival, and sustaining chronic inflammation in the synovium. Targeting this axis holds promise for novel therapeutic strategies aimed at reducing RA-related inflammation and joint damage. In spondyloarthritis (SPA), including ankylosing spondylitis (AS), CD74 plays a significant role, particularly in its interaction with macrophage migration inhibitory factor, influencing both inflammation and the immune response. The involvement of CD74 in SPA pathogenesis can be understood through several mechanisms. 1. MyF CD74 interaction and inflammatory pathways. Macrophage migration inhibitory factor is a key cytokine involved in immune responses, and its receptor is CD74. The MEMF CD74 axis has been found to contribute to chronic inflammation in SBA. MAF binding to CD74 on immune cells, such as macrophages, dendritic cells, and synovial fibroblasts, activates downstream signaling pathways, including the NF-QB, ERK-TAV, and PI3K ACT pathways, promoting the release of pro-inflammatory cytokines like TNF-α, IL-6, and IL-17. These cytokines play central roles in the pathogenesis of SBA, particularly TNF-α and IL-17, which are heavily involved in promoting inflammation and the recruitment of immune cells to entheses, the site where tendons and ligaments attach to bone and joints. Number 2, CD74 expression in enthesitis. Enthesitis, the hallmark feature of SPA, is characterized by inflammation at the attachment points of ligaments and tendons. CD74 is expressed in immune cells and fibroblasts present at entheses, contributing to local inflammation. The CD74 MyF axis can drive the recruitment of immune cells to these sites, where the local production of cytokines leads to the persistent inflammation characteristic of SBA. CD74-mediated signaling in the enthesis leads to an increased production of matrix metalloproteinases, MMPs, enzymes that degrade extracellular matrix components, potentially contributing to tissue damage and remodeling in SBA. 3. HLA-B27 and CD74 connection. The genetic predisposition to SBA, particularly the association with HLA-B27, suggests a link between MHC molecules and SBA pathogenesis. CD74, as a chaperone for MHC class II molecules, may have an indirect role in shaping immune responses in SBA. Although the exact mechanisms linking CD74 and HLA-B27 are still being investigated, there is a growing interest in understanding how these molecules interact to modulate immune responses in SBA, potentially through aberrant antigen presentation or misfolding of HLA-B27, leading to endoplasmic reticulum stress and activation of the unfolded protein response, UPR. CD74's involvement in the MHC class II antigen presentation process might influence the presentation of self-antigens, contributing to the autoimmune processes implicated in SBA. 4. Synovial inflammation and bone remodeling. In SBA, chronic inflammation in the synovium and entheses leads to a unique pattern of bone remodeling, characterized by both bone erosion and new bone formation, osteoproliferation. The MyF CD74 interaction plays a role in synovial fibroblast activation, leading to the production of inflammatory cytokines and osteoclastogenic factors, promoting bone erosion. On the other hand, the persistent inflammation also activates pathways involved in new bone formation, such as WNT signaling and bone morphogenetic proteins, BMPs. CD74's role in maintaining inflammation contributes to the dysregulation of these bone remodeling processes, leading to the characteristic bone changes seen in SBA, such as syndesmophytes, bony growths between vertebrae. 5. CD74 and TNF-α in SBA. In SBA, TNF-α is a major pro-inflammatory cytokine driving disease progression, and CD74's interaction with MyF enhances TNF-α production. This contributes to the TNF-α-rich environment seen in SBA, promoting inflammation in the joints, entheses, and spine. CD74 positive cells in the synovium and entheses are key players in this inflammatory process, as their activation leads to a cascade of cytokine production, further perpetuating inflammation and tissue damage. 6. Potential therapeutic target. Given CD74's role in SBA pathogenesis, particularly through its interaction with MIF, it has been considered a potential therapeutic target. Inhibitors of the MIF CD74 pathway are under investigation, as blocking this interaction may help reduce chronic inflammation and potentially slow the progression of SBA. Targeting CD74 could complement existing therapies like TNF inhibitors and IL-17 inhibitors, which are already part of the standard treatment for SBA. Summary of CD74's role in SBA pathogenesis. Immune dysregulation. CD74, through its interaction with MIF, contributes to the chronic immune activation seen in SBA. Inflammation at entheses. CD74 is involved in the recruitment and activation of immune cells at sites of enthesitis, leading to local inflammation and tissue damage. Bone remodeling. CD74 signaling influences the balance between bone erosion and new bone formation, contributing to the characteristic skeletal changes in SBA. Therapeutic potential. Targeting the CD74 MEF axis holds promise as a novel approach to modulating the inflammatory and bone remodeling processes in SBA. The MEF CD74 axis is a critical player in the inflammatory processes that drive SBA, making it an area of ongoing research and a potential target for future therapeutic interventions. Therapeutic approaches targeting CD74 in spondyloarthritis, SPA, and rheumatoid arthritis, RA, focus on inhibiting the MIF CD74 axis and modulating downstream inflammatory pathways. Here are some of the key strategies being explored. 1. MIF inhibitors. The MIF CD74 interaction plays a central role in driving inflammation, making MIF inhibitors a potential therapeutic strategy. MIF inhibitors work by blocking the binding of MIF to CD74, which can reduce the downstream production of pro-inflammatory cytokines such as TNF-α, IL-6, and IL-17. By disrupting this interaction, these inhibitors can prevent the activation of inflammatory cells that contribute to the chronic inflammation in both RA and SBA. Preclinical studies have shown promising results, and several small molecule inhibitors of MIF, such as ISO1 and 4-IPP, are being studied in inflammatory diseases. 2. CD74 antagonists. Direct inhibition of CD74 is another approach being investigated to reduce inflammation. By blocking CD74, these drugs prevent the interaction between CD74 and MIF, thereby inhibiting the signaling pathways that drive inflammation and tissue damage. Although still in the early stages of development, CD74 antagonists could provide an alternative therapeutic option for patients who are unresponsive to conventional treatments like TNF inhibitors. 3. Biologics targeting downstream cytokines. Since CD74 activation via MIF leads to the release of several key pro-inflammatory cytokines, e.g. TNF-α, IL-17, IL-6, biologic drugs that target these cytokines are already part of the treatment landscape for both RA and SBA. TNF-α inhibitors, drugs like infliximab, etanercept, adalimumab, and certolizumab target TNF-α and are highly effective in reducing inflammation and halting disease progression in both RA and SBA. While these biologics do not directly target the MIF CD74 pathway, they block a key cytokine that is upregulated by this pathway, thereby reducing inflammation. IL-17 inhibitors. Secukinumab and ixekizumab are monoclonal antibodies that target IL-17, a cytokine heavily involved in the pathogenesis of SPA, particularly ankylosing spondylitis. IL-17 is produced downstream of CD74 activation, making these inhibitors relevant in addressing the inflammation driven by the MIF CD74 axis in SPA. IL-6 inhibitors, tocilizumab, an IL-6 receptor antagonist, is used in the treatment of RA. IL-6 is one of the cytokines released in response to MIF CD74 signaling. Targeting IL-6 reduces the inflammatory response and has been shown to be effective in controlling symptoms and preventing joint damage in RA. 4. Corticosteroids and NSAIDs. While not specific to the CD74 pathway, corticosteroids and non-steroidal anti-inflammatory drugs are widely used in the management of RA and SBA to control inflammation and alleviate pain. These drugs work by reducing the levels of pro inflammatory cytokines and mediators like prostaglandins, indirectly affecting pathways that may involve CD74. Corticosteroids reduce the activation of macrophages and synovial cells, which are key players in CD74 mediated inflammation. 5. Targeting cell surface CD74 in B cells. CD74 plays a crucial role in B cell survival and proliferation, especially in RA, where autoantibody production by B cells drives disease progression. Therapeutic agents that target B cells, such as rituximab, a monoclonal antibody that depletes CD20 expressing B cells, may also have indirect effects on the CD74 mediated pathways. While rituximab doesn't directly target CD74, its depletion of B cells reduces the immune response driven by B cell antigen presentation and antibody production, processes in which CD74 plays a part. 6. Novel small molecule inhibitors. New small molecule inhibitors targeting the MFCD74 interaction or downstream signaling pathways like NFKB or E1 are under development. These compounds aim to block the inflammatory cascade initiated by the MyFCD74 axis without the need for biologic agents. Small molecules can offer advantages, such as oral administration, lower cost, and potentially fewer side effects compared to biologics. 7. Gene therapy approaches. Although still in experimental stages, gene therapy targeting the genes involved in CD74 or MEF expression is a potential avenue for treatment. By silencing or modifying the expression of CD74 or MIF, gene therapy could offer long-term control of inflammation. This approach is still largely in the preclinical phase, but holds promise for future interventions in autoimmune diseases like RA and SPA. 8. Peptide-based therapies. Peptide-based therapies, such as MIF-derived peptides, are being explored to block the MIF-CD74 interaction specifically. These peptides are designed to mimic parts of the MIF molecule, preventing its binding to CD74, thus inhibiting the inflammatory cascade. Summary of therapeutic approaches. 1. MIF inhibitors and CD74 antagonists block the core interaction driving inflammation in RA and SBA. 2. Biologics targeting cytokines, TNF-α, IL-17, IL-6, are already established therapies that modulate downstream effects of the MEF-CD74 pathway. 3. Small molecule inhibitors and gene therapy offer future potential by directly targeting the signaling mechanisms involved in CD74-mediated inflammation. 4. B-cell depletion therapies indirectly affect the CD74 pathway, particularly in RA. Corticosteroids and SADs provide symptom relief by dampening inflammation overall, though they are nonspecific. Given the involvement of the CD74 MEF axis in multiple inflammatory pathways, inhibiting this interaction could potentially provide a new therapeutic strategy, particularly for patients with refractory disease or those who don't respond well to existing treatments. These therapeutic innovations are still in various stages of research, but they hold promise in altering the course of both rheumatoid arthritis and spondyloarthritis.